He was a true gentleman. A lady would never open a car door when Dad was around.
Mum was a wonderful person, very reserved, quiet lady.
For the families who lost loved ones at Newmarch House, their memories and emotions are still raw. 2 years on, that experience has been relived as the New South Wales coroner investigated exactly what happened at the aged care home in Western Sydney. Ron Farrell was an RAAF veteran and father of 7 children. He had lived at Newmarch for 7 years before COVID arrived.
He did enjoy the time there. He made a lot of friends.
After the first positive case at Newmarch had been confirmed, Ron's family only found out by chance that he'd also been infected.
Dad was tested on the Tuesday. We waited all week to hear. We kept making phone calls. And she said, "Oh, you haven't heard?" And I said, "No." And she said, "Oh, your father tested positive for COVID."
He died 2 days later, aged 94.
They did hold the phone up to his ear. Don't know whether he heard me or not, but we just said, we just said we loved him. So.
He was the second of 19 Newmarch House residents to die from COVID. Eventually, more than a third of residents were infected. Ron's daughter, Virginia Clark, has found some of the evidence at the inquest concerning.
From what I'm hearing, nobody knew what anybody was doing and nobody had ultimate responsibility or ultimate control of what was going on.
No one seemed to know what the chain of command was. So I think it was very evident from the evidence we got that the house was just in complete chaos, and that didn't end until the outbreak did.
Head of Infectious Diseases at Nepean Hospital, James Branley, told the inquest he assumed the role of lead clinician at Newmarch House early in the outbreak. He said his role was as an advisor, not a decision maker. He said he turned up at Newmarch on April 12, Easter Sunday. 2 days later, they attempted to swab every resident, but systematic testing of all staff didn't begin until early May. Within a week, Dr. Branley said it was a crisis. On April 20, he says care and infection control were severely compromised due to critical staff shortages. He had advocated a hospital in the home model of care be used at Newmarch House. But that day, he asked the operator of the home, Anglicare, for a change of approach.
I said it's not working. I was putting up my hand and saying change course.
Dr. Branley conceded at that point he should have sent residents to hospital.
In retrospect, I should have gone back to Newmarch and done a round of the positives and picked people and sent them to hospital.
In a statement, Anglicare apologised for the distress experienced by residents and their loved ones and acknowledged that the physical separation contributed to that. But Anglicare declined to answer 730's questions while the coroner considers his findings.
Newmarch House is obviously owned by Anglicare, so the buck does stop with them as the owners. Anglicare should have taken control of the situation. It became evident that the system of management wasn't working and they should have stepped in much earlier on than they did and established better practices for keeping these residents safe.
It was really sold to us that it was a hospital in the home, and listening to the inquest, oh my goodness, it was anything but. They need to be taken out.
We'll have a big celebration when the lockdown's over, eh?
That's right.
For your birthday.
Louise Payne's mother, Yvonne Vane, caught COVID during the outbreak. Louise was one of many who would stand outside the home hoping for updates on loved ones.
You would hear on the news, 2 more people had died, and you would be thinking, was that my mother? It was never a protest. We were just there. We were hoping someone would come out. We knew that things were bad in there, but not knowing at all is just the most frustrating thing.
While her mother survived, Louise says she was never quite the same.
COVID certainly impacted on her hugely, but it was her mobility, her function. She was very deconditioned. Then when she was having falls, things weren't being put in place that would limit her risk.
In July last year, Newmarch House called an ambulance after Yvonne was unwell and she was taken to hospital. Louise wasn't called.
The call I did get was at 10 to 3 that in the morning, the following morning, from a doctor who said that Mum had come in about 11 o'clock. She said, "I'm sorry, I didn't get to see your mother. She has passed away." That's just been the hardest thing of all, to think that that was my worst fear when Mum had COVID, and it was realised anyway because of the communication. It didn't improve. How could that happen?
7:30 sent detailed questions to Anglicare about what happened to Yvonne Vane. Anglicare declined to answer, even though her death was not one being investigated by the coroner.
I think we've got to put things in place so that this can never happen again, and they get the care they need every day, from the day they go in there to the day they pass away.
Virginia Clark says she is frustrated that older people's deaths are often discounted with references to their age and pre-existing conditions. She says while her father was 94, he still had plenty he was looking forward to.
He had already planned his 95th birthday. Again, he wanted to have it at my place. He wanted a barbecue because he loved barbecues. And some of the family that could come were going to come. He used to enjoy seeing all his grandchildren and all his great-grandchildren.
Findings from the coroner aren't expected until next year.
I just think that we need to do more for these people. So to me, it's not really about the justice, it's about improving and learning lessons from what happened at Newmarch House.